Hi everyone, in this video we are going to see about bronchodilators. Myself Julian K. Thomas, faculty working in Triplet College of Nursing. The learning objective of this presentation include the group should be able to define bronchodilators, explain the mechanism of bronchodilators, enumerate the classification of bronchodilators, brief the methods of administration of bronchodilators, and enlist the side effects of bronchodilators. What is a bronchodilator? A bronchodilator, it is also known as broncholytic, is a medication that dilates the bronchi and bronchioles, which decreases the resistance in the respiratory airway and it increases airflow to the lungs. It helps breathing by keeping the airway dilated. What are the indications of using bronchodilators? Bronchodilators can be used in obstructive lung diseases. The obstructive lung diseases include asthma and chronic obstructive pulmonary disease, otherwise known as COPD, or chronic bronchitis or emphysema, in which the clients suffer from narrowing and obstruction of the airways. As we have seen in the last slide, the main indications for using bronchodilator is asthma or COPD. Just we'll have a look on what is asthma and COPD. Asthma is characterized by chronic inflammation in the lungs as well as asthma exacerbation or attacks where certain triggers such as viruses, allergens, stress, aspirin or other NSAIDs or exercises can lead to reversible bronchial smooth muscle spasm and mucus production. As a result, the client experienced symptoms like dyspnea, wheezing, chest tightness and coughing. On the other hand, the COPD is a chronic inflammation and fibrosis in the lungs, most commonly due to smoking. The result is that the airway becomes irreversibly obstructed and the lungs are not able to empty properly, which leaves air trapped inside the lungs. As a result, client experiences symptoms like dyspnea and productive cough. So what is the approach for treatment of asthma? So as we have seen, any allergens or any antigens, infections or some noxious gases or dust, cold or drugs can cause inflammation to the airway. So whenever there is an inflammation in the airway, it can leads into bronchial hyperactivity. So the bronchial hyperactivities can leads to bronchial spasm. So bronchospasm can be treated either we have three methods. Either we need to avoid the exposure or treat the inflammation or we need to dilate the bronchi. So here dilatation of the bronchi is possible with the help of bronchodilators. How bronchodilator works? Bronchodilators work by relaxing the muscles in the airway. Bronchodilators helps to relax the smooth muscles of the airway. The relaxation causes the airways to open up and the bronchial tubes to widen. There are different types of bronchodilators which can work slightly in different ways. So which includes the classification of bronchodilators include beta 2 agonist, anticholinergics and xanthine derivatives. Types of bronchodilators. There are two types of bronchodilators. One is long-acting bronchodilators, which will act for a long time, and short-acting, it is very rapid-acting bronchodilators. So first we'll see short-acting bronchodilators. So what is a short-acting bronchodilators? Short-acting bronchodilators work quickly, usually within a few minutes. Although they work fast, the therapeutic effects generally only last for 4 to 5 hours. Short-acting bronchodilators treat sudden symptoms of asthma and COPD, and people do not need to use them when they are symptom-free. It is also known as rescue inhalers or fast-acting inhalers. Next, we'll see long-acting bronchodilators. Long-acting bronchodilators does not work as quickly as short-acting bronchodilators and it does not treat acute or sudden symptoms of asthma or COPD. The effect can last up to 24 hours and people take them daily to prevent symptoms from developing any asthma or COPD. So common long-acting bronchodilators include salmeterol, otherwise it is known as Ceraven, formoterol, aclidinium, tiotropium and umcillidinium. So these are some of the classifications of long-acting bronchodilators. So this bronchodilators act some time to act on the smooth muscles of the bronchioles. So these are the classifications of bronchodilators. So bronchodilators commonly we can classify it into three: sympathomimetics, anticholinergics, and methylxanthine. So sympathomimetics again we have catecholamines and non-catecholamines, and anticholinergics which include ipratropium bromide and atropine methyl nitrate or atropine, and methylxanthines which includes the theophylline. Beta 2 agonist. So this class of bronchodilators cause the smooth muscle surrounding the airways to relax by stimulating beta adrenoreceptors in the airways. This improves airflow and reduces the symptoms such as shortness of breath. Beta 2 agonists come in short-acting varieties to dilate the airways immediately, as well as long-acting varieties which maintains open airway. Short-acting beta 2 agonists include salbutamol, that is albuterol, levoalbuterol, and pirbuterol. Next is anticholinergic. Anticholinergic is a bronchodilator which block the action of acetylcholine. Acetylcholine is a chemical released by the nerves that can lead to tightening of the bronchial tubes. So by blocking this chemical, anticholinergic bronchodilators which cause the airways to relax and open. Same like beta 2 agonist, anticholinergic drugs also come in both short-acting and long-acting form. Some of the long-acting forms include aclidinium bromide, tiotropium bromide, glycopyrrolate or glycopyrronium bromide, umeclidinium bromide. Ipratropium is an example of short-acting anticholinergic. Next classification is xanthine derivatives. Xanthine derivatives also relax the airway muscles, although doctors do not know precisely how they work. The main xanthine derivative is theophylline. Theophylline comes in an oral and intravenous injectable form. Doctors rarely prescribe this theophylline due to many people experience significant side effects. So the relatively low doses can be given in case of severe breathing difficulty. The common side effects of xanthine derivatives include nausea, vomiting, irregular heart rhythms, irritability, dizziness, and seizures. For this reason, it is safe to try other drugs first. If all other drugs is not working for the patient, then we can go with xanthine derivatives. If those do not work, doctor should start with a low dose, monitoring the symptoms consistently and slowly increase the dosage based on how well a person tolerates the drug. Methods of administration of bronchodilators. How bronchodilators can be administered. It is important to understand how to take bronchodilators correctly to ensure the most medication possible reaches the lungs. The most common ways of administering bronchodilators include: the first method is metered dose inhalers. A metered dose inhaler, or it is known as MDI, is a small pressurized canister that contains the medication. The device releases the medication when a person presses down the canister, example salbutamol or terbutaline. A propellant in the MDI carries the medication dose into the lungs. The second method used for the administration of bronchodilators include nebulizer. A nebulizer uses bronchodilator medication in the form of a liquid and turns it into an aerosol that the person then inhales through the mouthpiece. And the third one is dry powder inhaler. A dry powder inhaler does not have a propellant and the bronchodilators is in the powder form. The example of dry powder inhaler is albuterol sulfate or fluticasone furan or fluticasone propionate. And the last method of administration of bronchodilators is soft mist inhaler. Some bronchodilators are available in soft mist inhalers. Soft mist inhalers delivers an aerosol cloud into the lungs without a propellant. The example for soft mist inhaler is tiotropium or olodaterol. So these are the examples of soft mist inhaler. The common complications associated with bronchodilators include increased heart rate, tremors, nervousness, cough, dry mouth, nausea, headache, and low potassium. So to conclude, bronchodilators are a class of medication that relaxes the muscles surrounding the airways. Bronchodilators are one of the main treatments for respiratory disease such as asthma, COPD, and chronic bronchitis. There are two broad categories of bronchodilators, that is short-acting and long-acting. The type a person chooses to use can depend on their circumstances, preferences, age, and symptom severity. Although bronchodilators can reduce symptoms such as wheezing and trouble breathing, they may also cause side effects. People with lung conditions can work with their healthcare professional to determine if the benefits of bronchodilators outweigh the possible side effects. Thank you.